Okay, so um, a pretty morning, everyone. We are the Group 7, which are going to present to you the Chapter 10, which will discuss about the drugs. Okay, we will start. Okay, so let's discuss about drug abuse. So, what is drug abuse? According to the book, drug abuse is a disorder that is characterized by a destructive pattern of using a substance that leads to significant problems or distress. So, drug abuse is also called as drug addiction. And the worst you can say in the visual aid can be is connected to drug abuse such as rehab, patients, remission, blackout, medicine, um, suicide, health intervention, emergency room, um, facility, relapse, injection, psychosis, disease, and everything. Okay, so drug abuse, also called substance abuse or chemical abuse, is a disorder that is characterized by a destructive pattern of using a substance that leads to significant problems or distress. It affects more than 7% of people at some point in their lives. Teens are increasingly engaging in prescription drug abuse, particularly narcotics, which are prescribed to relieve severe pain, and stimulant medications, such as those steroids. Many muscle freaks inject steroids in order to build their muscles up, and it also make them addicted to it, which treat conditions like attention deficit disorder and narcolepsy. Okay.
What is drug addiction? Drug addiction is also called substance use disorder. It is a disease that affects a person's brain and behavior and leads to an inability to control the use of legal or illegal drug or medication. Substances such as alcohol, marijuana, and nicotine are also considered drugs.
Good morning, leaders. My name is Jules Elagdamin, BSME 1 Set A, and my topic for to discuss today is symptoms of drug addiction. So here is the list of symptoms of drug addiction or behavior include, among others, feeling that you have to use drugs regularly, daily, or even several times a day. Gusto na ng user na palaging gumagamit ng drugs. Pinagawa na lang maintenance ang illegal drugs. Having intense urges for the drug that block out any other thoughts. Sometimes, kapag sagad na sagad ang user sa paggamit ng drugs, magiging mentally block sila. Over time, needing more of the drugs to get the same effect. Like what I said, kapag nag-take ang user ng illegal drugs, gusto na lang palagi i-maintain para hindi mawala ang side effects sa kanila. Taking larger amount of drugs over a longer period of time than you intended. Kapag mapadami sa drugs, matagal rin mawala ang effect. Making a certain that you maintain a supply of drug. One of the behavior of user is having a supply of illegal drug na dapat meron sila lagi at laging magagamit. Spending money on the drug even though they can't afford it. Maraming cases ito. Kahit na hindi na makabili ng pagkain ang pamilya, mas uunahin pa rin mga problema sa pambili ng drug. Not meeting obligations and work responsibilities, or cutting back on social or recreational activities because of drug use. Result of using of illegal drug ay hindi na pagiging productive. Nagwo-work na lang sila or ang user para lang sa pambili ng illegal drugs. Continuing to use the drug even though they know it causing problem in your life or causing their physical or psychological harm. Kahit alam na ng user na bawal at illegal talaga ang paggamit ng drugs, at makadagdag lang sa problema at magiging miserable lang ang kanilang buhay, patuloy pa rin sila sa paggamit ng illegal drugs. Doing things to get the drugs that you normally would not do, such as stealing. Kaya kapag gumagamit ka na ng illegal drugs, magawa mo nang magnakaw. Kasi kapos ka na at kailangan mo na ng drugs na magagamit. Hinahanap kasi ng katawan. Driving or doing other risky activities when you're under the influence of drugs. Kaya kapag meron pang effect ng drugs sa iyo mentally, parang kaya mong gawing lahat. Risky activities kaya mong gawin. Spending a good deal of time getting the drug, using the drug, or recovering from the effect of the drug. Sa mga users, ini-enjoy na lang nila ang paggamit ng drugs. Kasi kapag gumagamit sila at meron pang effect, sa tingin nila kapag gumagamit ulit sila, unti-unti nang mawawala ang effect. Failing in your attempt to stop using the drug. Ang mga user ay nafe-fail rin sila sa pag-attempt sa paghinto ng paggamit ng drugs kasi hinana pa rin ang katawan nila. Experiencing withdrawal symptoms when you attempt to stop taking the drugs. Kapag ang user ay nag-attempt na maghinto na sa paggamit ng drugs, nahihirapan pa rin sila kasi nga nasa mentally pa rin nila na kailangan nila ang drugs. And that's all my topic. Thank you.
In his or her room, or being secretive about where he or she goes with friends, are drastic changes in behavior and in relationships with family and friends. Money issues, sudden request for money without a reasonable explanation, or your discovery that money is missing or has been stolen, or that items have disappeared from your home, indicating maybe they're being sold to support drug use.
What types of drugs are common abuse? These are virtually any substance whose injection or result in a euphoric, high feeling can be abused, while any are aware of the abuse of illegal substance. This is an example of drugs are common abuse, like alcohol or illegal drugs like marijuana in most states and cocaine. Less well known in the fact of the inhalants like household cleaners are some of the most commonly abused substances. The following are many of the drugs and types of drugs that commonly abuse and or result in independence. This is a type of drugs are common abuse. Alcohol. Alcohol, although legal alcohol is a toxic substance, particularly to a developing fetus when a mother consumes this drug during pregnancy. One of the most common addiction, alcohol can have devastating effect on the alcohol individual physical health as well as his or her ability to function interpersonal and at work. Amphetamines. Amphetamines, this group of drugs comes in many forms from prescription medication like methylphenidate, Ritalin, Concerta, and dextroamphetamine and amphetamine. Adderall to illegal manufactured drugs like methamphetamine or meth overdose of any or this substance can result in serious in health. Anabolic steroid, a group of substance abused by bodybuilders and other athletics. This group of drugs can lead to terrible psychological effects like aggression and paranoia, or as well as devastating long-term physical effects like infertility and organ failure. Caffeine. While it is consumed by many, coffee, tea, and soda drink, when consumed in excess, this substance can be habit-forming and produce palpitation, insomnia, tremors, and significant anxiety. Cannabis, more commonly called marijuana. The scientific name of cannabis is tetrahydrocannabinol or THC. In addition to the negative effect the drug itself can produce, for example, infertility, paranoia, lack of motivation. The fact that is commonly mixed with other substances to drug dealers can make more money selling the dilute substance or expose user to most addictive drugs, expose the marijuana user to the danger associated with those added substance. Example of ingredients that marijuana is commonly cut with include baby powder, oregano, embalming fluid, PCP, opiates, and cocaine. Cocaine, a drug that tends to stimulate the nervous system. Cocaine can be snorted in powder form, smoked when in the form of rock, or injected when made into a liquid. Ecstasy, also called MDMA, to denote its chemical composition, methyldioxamphetamine. This drug tends to create a sense of euphoria and an expansive love or desire to nurture other and overdose. It can increase body temperature to the point of being fatal. Hallucinogens. Example include LSD, the mescaline, as well as called naturally occurring hallucinogen like certain mushroom. These drugs can be dangerous in their ability to alter the perception of the user. For example, a person who intoxicated when a hallucinogen may perceive danger where there's a none in the to think that situations that are truly dangerous are not. Those mean perception can result in dangerous behavior like jumping out of a window because the individual thinks they are riding on an elephant that can fly. Inhalants, one of the most commonly abused Inhalants, one of the most commonly abused group of substance due to its accessibility. Inhalants are actually contained in household cleaners like ammonia, bleach, and other substances that emit fumes. Brain damage, even to the point of death, can result from using an inhalants just once over the course of time, depending on the individual. Nicotine. The addictive The addictive substance found in the cigarettes. Nicotine is actually of the most addictive substance that exists. In fact, nicotine addiction is often compared to the intense addictiveness associated with opiates like heroin. Opiates. This group is also called narcotics and includes drugs like heroin, codeine, Vicodin, Oxycontin, Percocet, and Percodan. This group of substances sharply decreases the functioning of the nervous system. The lethality of the opiates often the result of the abuser having to use increasingly higher amount of to achieve the same level of intoxication, ultimately to the point that the dose needed to get high in the same as the dose that is lethal for the individual by halting the person breathing, respiratory arrest. Penicillin. Commonly to as PCP, these drugs are cause the user to feel extremely paranoid, become quiet, aggressive, and to have an unusual amount of physical strength. This can make the individual quiet, dangerous to others. Sedative, hypnotic, or anxiety drugs. As these substances quell or depress the nervous system, they can cause health by respiratory arrest of the person who either use these drugs in overdose or who mix one or more of these drugs with another nervous system. Depressant drug like alcohol, another sedative drugs, or an opiate.
What are the physical and psychological effects of drug abuse and addiction? While the specific physical and psychological effects of drug abuse and addiction tend to vary based on the particular substance involved, the general effects of abuse or addiction to any drug can be devastating. Psychologically, intoxication with or withdrawal from a substance can cause everything from euphoria, as with alcohol, ecstasy, or inhalant intoxication, to paranoia with marijuana or steroid intoxication, to severe depression or suicidal thoughts with cocaine or amphetamine withdrawal. In terms of effects on the body, intoxication with a substance can cause physical effects that range from marked sleepiness and slow breathing, as with intoxication with heroin or sedative hypnotic drugs, to the rapid heart rate of cocaine intoxication, or the tremors, the seizures of alcohol withdrawal.
What is drug treatment? Drug treatment can include behavioral therapy such as cognitive behavioral therapy or contingency management, medication, or their combination. The specific type of treatment or combination of treatments will vary depending on the patient's individual needs and often on the types of drug they use.